Doctor, I've seen people and I come across friends and family that they go normally to do alternate medicine before opting for the operation. So normally mid-age ladies also, so they want to try out alternative medicine before choosing operation. Can you explain that why they do that?
It's very common, and it's common in not only in India, in a lot of other countries as well. It could just be because of the phobia of the surgery. You see, the nobody would like to have an operation, which is, of course, it's difficult and it needs expenses, and complications can arise. So many issues are around with the any kind of surgery. However, what is important here is, the what kind of knowledge or, the information is being passed to our patients in this country. For example, if somebody know it very sure that, any kind of these alternative therapy or any kind of these medicines are not going to help them, if they know it for sure, probably they will not do it. But unfortunately, the system we are in will not allow us to do that. For example, in most of these wear and tear arthritis, either rheumatoid arthritis or an osteoarthritis or any kind of this, what we call as a sandhivat, the cartilage inside the joint gets worn out. Cartilage is a rubber like cushion inside the knee joint. Now, this cartilage will not grow with any kind of medicine on this earth. For example, you can see that a lot of such advertisements on a morning televisions on most of the days, all kind of medicines and the herbs and the oils and the bottles with very, very attractive name, with like either ortho or sandhi or gunasandhi or something of that kind. You keep seeing them on the television. People should know that these advertisements cost hell lot. And, these people come there and, tell or misguide people as if, they are going to cure the cartilages. And this kind of news spreads all across the community. And, you can imagine that, we have different level of education, different type of population who cannot actually scientifically analyze all this data. And, people get influenced by all this adverse canvassing or propaganda, which probably causes a lot of problem in the modern, even, the countries and in India, all over the, different channels and different, the Facebook or social media, it is there. Those kind of advertisements probably cause a lot of misunderstanding among the people. I think, there is a urgent need from the legal perspective or from the government. Such advertisements or, such misleading information should be banned from advertising, so that, the people are not being told something which is wrong. Because if the cartilage, whichever has been worn out from any disease, if they get it back, in fact, they get a Bharata Ratna or Nobel Prize tomorrow, which in fact, none of them will try. In fact, they look for some patients in the society to sell those medicines on a daily basis. That is one of the reasons. Now, the second reason, see, we have come from some kind of our ancient background, and we all believe and respect our parampara and all our ancient system. Now, we have believed them, we respected them, but as science changed, we have changed a lot, in terms of the medicine, in terms of the practice, in terms of the life. But what happens is that when a name of the surgery comes to their, mind, they always would like to try something which can easily be done. This also happens because of the influence by the relatives and the friends. In fact, none of them will know anything about the joint replacements or the joint. Their information itself might have come from some very unreliable resources, either, in the media or by somebody else giving them a free advice. And hence, what happens is that, a lot of people, when the name surgery has been told, one, because of this, it is a surgery. Second, because of its cost involved. And also these kind of information, which is circulating all over the world, a lot of these patients go for Ayurvedic, homeopathic, and a lot of other kind of medicines. In fact, they all should be aware that, the worn out cartilage has never come back with any of these kind of medicines, including the modern medicines, however long you may take. Only good thing is the 90% of these patients will not need an operation because it is not a severe kind of medical condition. It's a painful condition. And if it is so severe, and in the elderly patients, only way is, you replace the joint so that, their mobility and pain will improve. And in fact, the program like yours today should tell them, or, it should be circulated so that, that people can understand and, realize that what is real scientific, thinking about the joints and cartilage and joint replacement surgery and the alternative therapies. In fact, you get these examples in all the hospitals, all major hospitals on a daily basis, how these joints and arthritis, and in fact, the many other medical conditions have been mismanaged by all this misbelief and misconception only. So the honest advice is, see a doctor who is qualified to deal with them. And, if you are not sure, you take any number of opinions, but remember that a scientific evidence is something which you have to go behind. Otherwise, you will unnecessarily get into trouble and get into either chronicity, long-term problem, or complications with the condition you are suffering from.
I totally agree with you, doctor. Like people, they want easy solution. That's why they pray for misguidance, and your guidance definitely help many out there who believe and pray to false opinions.
Yeah, definitely.
Doctor, we have seen that communication is a very vital part in handling the patient. So communication skills are the utmost importance when providing healthcare services. Effective communication is bidirectional between patients and healthcare systems. So, how important is communication? Important boosting the confidence of the patient before getting ready for the operation.
And I completely agree with that, and believe that, the communication probably is the most important thing, not just in the joint replacement surgery, but every part or every aspect of the medicine, we deal with human beings. Because the communication, if it is done properly, that leads to a lot of confidence and, take away a lot of these misconceptions, which makes the doctor's job easy as well as the patient's job easy. It's very important. For example, for a patient with a joint replacement surgery, typical way to understand and gain confidence and get communicated properly, there is a process. For example, the units like ours have a counseling system. For example, if a patient coming for a joint pain, they will go through all sort of, information, whatever they need. And also everything has been explained by someone of us all the time. And it happens every day. For example, the patients will be explained on how exactly the joint replacement is done. Patient will be explained also on what is the need of this joint replacement, and we compare that and show them to a normal person's x-ray. And also we'll explain to them the whole process involved, what happens to them, in terms of walking, in terms of their daily activity, in terms of their recovery, the medicines what they have to take. In fact, some of the things which can easily help these patients is they do their own study. For example, you see, if they go through the proper route, like an internet study, go through the proper site, not just Google something, somebody's inappropriate blogs or something of that kind. Go to a proper scientific information. In the family, for example, like you did for your mother, the people can understand, study, talk to the people, read about all the information, and then, understand the process properly before coming to the hospital. In fact, I encourage all these my patients to study, and sometimes I give them a topic what to study before they have a joint replacement surgery. The second thing is the literature. You see, I have written a book on the joint replacement surgery. Somebody who is interested can go through the book and understand every aspect. For example, if they go through a section on a joint replacement surgery for a young adult, they can understand everything, when it is done, why it is done, and how it is done for a young person. And similarly for patients with other medical conditions. So communication is very important. And also there should be an attempt from both patient and the surgeon or his physician to understand the process and making sure that both of them understand each other properly. the patient's condition, the doctor should understand, and the doctor's operation, the patient should understand properly. Then everything becomes really easy. In fact, I have operated over 50 to 53 medical doctors. All these doctors who had a joint replacement surgery by me are extremely happy compared to the other population. It's basically because they are doctors and they have gone through all the details, they understand everything, and the process becomes so easy for them. For example, if somebody has a pain third day after the joint replacement surgery, if you are aware that there is a wound on the knee which is not healed yet, it's going to give you some pain, and if you take a painkiller, it is done. But for a patient, if he thinks like, oh, I have a pain after 3 days which has not been explained to me, there must be something really wrong. The knee replacement probably started failing within third day itself. You see, just the information or explanation will make these patients so happy. And hence, this group of patients, the doctors, for example, what I told you, who are well informed, who have been very nicely informed about the surgical process by themselves because they are in the profession, they do greatly well. And which gives us an evidence that the patients who have been explained well, patients who are educated well in terms of the medical science behind the joint replacement, they always do well. And hence, I think, the doctors also should be very sympathetic, in terms of answering all the questions and also clearing all the doubts of these patients. So the communication, I think, is the most important part. And hence, it's been said in so many meetings and also in the literature that surgery can be very precise, etc. But the precision is not that important as a decision. So the decision becomes more important than the precision of the surgery. And hence, very important thing is communicate among the patient's group and the family, and if possible, educate them with a media like yours, which is very, very important.
Definitely, I totally agree with you because I have witnessed with my mother. So, like educating her the process, she was convinced. So she was able to get that confidence to get operated. Thank you for sharing. Doctor, would you like to share a few memorable moments which must have changed your thought process towards life?
Well, there are several examples, and that's why you see the doctors tell their work as a practice. They never say it's work. So you say the doctor's practice, where somebody else's it is work. So we keep practicing every day. What it means is that we keep learning every day, and probably we have such lessons on a daily basis. Several such examples, and in fact, as the health is concerned and the body is concerned, it's both physical and psychological and emotional, and we get these kind of events every other day in the hospital. Especially, you can imagine working with this corona in last 1.5 years, and how the people and the doctors and the healthcare professionals would have felt whole year, with the life being probably so much under stress and philosophical, most likely how to come out of this kind of crisis. As far as orthopedics is concerned and our joint replacements are concerned, I can remember several such examples which are both emotionally and also the medically very, very tough situations, which probably can change so many other people's life. For example, this lady who is a lowly mother of 2 children in her 50s, suffers from an arthritis in the joint from many, many years. Like 15 years, she was using a 4-legged walker frame and, in a lot of pain. And she has been consulting her local non-medical medical practitioner, who is, in medical language, we call them as quacks, that, the guy who is not qualified. And in the middle of Bangalore, has dissuaded her that you should never have a joint replacement surgery, because he gave his own explanations which are completely unscientific, because these people believed him so much that they are always worried that she should never be able to walk, and they never approached a proper orthopedic surgeon for the treatment. Now, how emotional the situation can be, you can imagine. This lady, when I saw her, she said, "Doctor, with all these things, and my son and my husband put me on a chair, and I cook for the whole family on the chair itself. You can imagine 15 years she has been living like that, and the cooking and the looking after the family with that kind of legs on both sides. You can see in the next example. And she didn't approach us as well. One day, as the life becomes so difficult, even going to the basic needs of the toilet and the bathroom, she fell in the washroom and she broke her hip as well. And that is when, she came to us, and, they lost all hope that, that she cannot walk, now has broken her hip. She is almost like, they lost all hope that, she's not going to make it. I fixed her hip with the medical rod, and, her hip bone became good. Then, one day I told her that, you should get her knee replacement done. This is about 7 years ago now. And I did her both knee replacements simultaneously. And you can see her now after 7 years after the operation. She walks normally on the corridor, on the stairs, as if, she is a normal person. The gratitude this family has towards the medical profession, not just me, is immense. And, sometimes you feel that, the touch, the feelings and this emotion, you feel between, a doctor and the patient, you cannot measure that. Probably you can feel only, when you see those patients, in real life. And that has changed, in terms of, how do you feel about your patient? For example, you see, you help them out. It is such a life-changing decision for these patients, one thing. And second thing is, you also feel why there are such a lot of people who misguide these patients all the time in the whole country, giving them wrong advice and also, playing with their life. Second is another similar example. And this lady has arthritis from last 10-15 years. And she's been living in the US with her software engineer, where she was being treated with the modern medicines. In fact, the same kind of drugs what we use in this country as well. And rheumatoid arthritis is a not curable disease, we understand that. And the only medicine available is to control pain and also control the disease activity. If the modern medicine is given, these patients live into their 70s and 80s without much problem, and they live a common, a normal life with medications. However, the frustration of not getting better has actually gave them a lot of headache, and they were in a lot of stress. So one day, with consultation with her family and, the husband, they decided to come back to India and explore alternative medicine. What happened is, when she was in India for about now 6 years, she has not taken modern medicine. Somebody has brainwashed her not to eat rice, not to eat aloo, not to eat egg, not to eat anything, patya. And, you take these kind of powder and these kind of leaves only. And, that is the best medicine for two reasons: that don't go to the real doctors, they will give you medicine which will cause you side effect. Or, they don't go to the doctors, they will operate to make money. So that is how it is so easy to brainwash these patients. So that lady tried and tried for 6 years. And you can imagine that, the young lady with 2 kids, her body weight came down to 37 kgs. And you can imagine that what kind of stamina she had to look after herself, look after her life. And when I came to me, in fact, I didn't, really know what exactly to do. Shall I cry or shall I shout at her, kind of situation? And I told her that, everything what I've been doing is completely wrong. For example, the same aloo, the same rice, and, the same chana, the people in US and UK can eat nicely even when they have rheumatoid arthritis without any problem. How can that cause problem only in India for you? And you see, you being an educated person, you should be thinking that, and, should be able to manage it nicely. So when she came to me, her weight is 37 kgs. She is barely able to walk to the bathroom toilet. The husband is frustrated looking after all these issues and the pain of the family, you can imagine. So because of not taking proper medicines for 6-7 years continuously for this misconception, she had both hip and knee joints completely destroyed. That is what happens if you don't take medicines for rheumatoid arthritis. It's a progressive disease. It gets worse, and to an extent that some people may need all four joints replaced, hips and knees, and sometimes it can affect the shoulder, the knees, and the neck. So ultimately, I had to replace her hip and start her on the modern medicine. The conversation and educating this lady, you can imagine, was so difficult that, in fact, I thought this lady may never come back to me, because I was so very strict, or to the point that, she was doing the wrong thing for last 6-7 years. You can imagine it's not easy to blame someone that you are doing something wrong and to convince them that, they are really doing it wrong. So now she has gained weight. She's walking properly. I have replaced the 2 joints, and she may need another 2 joints. But you see, you can see that she is improving. She is able to walk properly, and she is able to start her daily activities as much as she needed for her basic daily life. All these examples which you see on a daily basis, basically influence all of the medical faculty or fraternity in this country, that even though we have a large skilled medical force in this country, a lot of people are still cheated by the not availing these services which are available for them. And in terms of the life, when you see all of them on a daily basis, both in personal life and public life, I'm sure a lot of us have a lot of such examples which has changed our mindset and our perspective about the life.
Yes, as you rightly said, like your experience is such a eye-opener, and as you rightly said, gratitude we can't be measured. So definitely,
Correct.
those patients who got the right medicine at the right time, they are really grateful
Correct.
for you. Thank you for sharing. Before we end, Doctor, our audience definitely will look forward to your valuable message and tip to safeguard our knee. Can you please share the tips?
This is a very common question which is asked to me on a daily basis, because see, most of the patients who come for a knee replacement do come with their younger children. And the last question usually they ask is, how do we prevent for themselves? Which is such a common and important, the question in the public domain. It's 2 parts to this. Scientifically, the cartilage inside the joint which is worn out will not come back. And hence, people should not be thinking that if I start taking some medicines when I am young itself, or, if I start eating some kind of thylam or some kind of medicines or some kind of churna or whatever, my cartilage will get better and, I will save them for long. It is not true, which is also true that, if you take the modern medicines, so the cartilage growing or the prevention of arthritis by medical means, in terms of the chemicals or other medicines, is not possible, which is very important to understand. Otherwise, people keep using these kind of medicines unnecessarily and, end up with either, the physical or a chemical or some kind of side effects, or at least, the stress and expenses of these medicines, which are completely useless. However, what should people be doing to help their knees for the future is something they should do for the general body. Look after your body nicely. Probably that will help the knee as well. First thing is, you all know, little walk, preventing obesity, regular exercises, that will keep your body well, and that will keep your knee well as well. So a lot of these questions, when they asked in my OPD, I usually joke with these patients that, the only way you to prevent that knee arthritis or knee wear and tear when you are older, most likely is not getting older, which is obviously is not possible. So you can help your knee by preventing obesity. You can help your knee by looking after your body nicely. You can help your knee by keeping yourself fit with exercises, etc. In terms of the diet, the calcium and vitamin D are generally good and necessary for the bone. That doesn't mean that everybody in the community should eating those calcium and vitamin D every day. Only those patients who are in need, with the help of your doctor, should get the vitamin D and the calcium, so that they don't develop the bone mineral or vitamin D deficiency. People also make sure that they don't get knee injuries, as a part of their sports injuries. Injured knees, like ligament injuries, the meniscal injuries, or the fractures inside the joint, will lead to the wear and tear of their joint and early knee replacement. And hence, it's important that you prevent these sports injuries as well as you treat them if they happen very quickly so that the joints don't get degenerated because you have ignored them. Some of the profession which sometimes inevitable are associated with more of knee damage or a knee osteoarthritis or a wear and tear when they are older. This profession has been identified as something which involves kneeling on the floor or a squatting type. For example, the blacksmiths, the kamaru, and also the people who sit on the floor to lay the tiles. So the most of these people who sit on the floor in different positions, like a squatting position or a cross-leg positions, or the manual job, like a heavy job of laying tiles or granite on the floor, they are associated with more of these problems with the knee joint later. And hence it's so important that we prevent these injuries in those patients who have risk. For example, the parents are having knee problems, arthritis, etc. Probably these patients should not be doing that job. And also the patients who have little pain in the knee, if they continue to do the same job, probably they have accelerated wear or early damage to their joint. So it may be necessary for these patients to either avoid those jobs or change their jobs depending on their, the individual feasibility. Other things about the knee joints are the fractures happening during road traffic accidents and also the infections. These ones are difficult to prevent, and every strategy, both in terms of the legal or political way, these accidents and should be as much as possible prevented. But if they happen around the joint, they should be promptly treated by a qualified or a trained orthopedic surgeon so that a joint is reconstructed properly back to the original position. So in nutshell, for the common people, most of the 90% of the people who have this question that, how to prevent the joint degeneration or osteoarthritis or wear and tear, or, if somebody want to prevent their knee replacement in the future, it can be difficult, but, they look after your body nicely. Probably that itself will help to protect or prevent these kind of problems in their knee. Thank you.
Thank you so much, Doctor, for your valuable time to share your experience to bring awareness about what, when, and how of knee surgery. I believe our audience got value addition, which is the motto of my channel. More details regarding the topic definitely will be mentioned in the description section. So thank you so
Thank
much.
you. Thank you, and all the best for your channel, and my regards to your mother, who was one of my patients. Thank you.
Yeah,
Thank
welcome,
you.
sir. So I
Thank
request
you.
our audience to spread this awareness by sharing this information, which may be of help to someone out there. Happy to come up with many more interesting topics soon. Stay tuned. Thank you.
Thank you.